This discussion, I want us to begin by looking at the stories on the two dailies, but most importantly, you'll see that there's hope of reopening. CS Magoha is hopeful school will resume for third term early next month as scheduled. He spoke yesterday in saying that the COVID-19 curve appears to be flattening, and like I said earlier, I'm not sure about that, because if you look at the positivity rate, it remains high. As of yesterday, we reported a positivity rate of I believe it was 16.2% or 16.3%, just after 11.7%, which was on Sunday. So the number of people that are being tested appears to be going down compared to a time that we reported 11,352 samples. Yesterday, 2,989 were reported to have been tested. And I want to begin there by asking you what your feeling is about how we are handling the pandemic. Of course, you remember some of the measures that were announced by the President on 26th of March. There's been many concerns, cries about the economic opportunities that have been lost. Are we on the path to ensuring that once we reopen, we're at a safe place? If you are able to look at that, Alice Wahome?
I wouldn't say we are in a safe place. I think the pandemic is still a challenge. The way the country has handled it from the beginning, I want to say maybe if I were to give them a score, it's maybe 50-50. Save for the fact that the things that we needed to do, we have not done. I think our hospitals are still unattended to. The PPEs, the doctors are still having to work under that challenge without sufficient PPEs. The COVID money is still being said to have been lost. And even currently, I think there are still cases of how we are going to be able to implement to carry out the vaccinations. You see, we are hearing serious conversations that there may be a shortage even before we have started the real rolling out, because I think that we just started to give the frontline personnel or workers. So even before we have gone to the general public, and even the elderly, the 58 plus, have not even been really, it hasn't taken off in the real sense. I say that because I took my vaccination in my own sub-county. Is it level 4? It's a level 4 which has nothing to speak to level 4, because we don't even have a single ward bed. So we haven't seen in our counties what facilities are there, what had we planned to have. Therefore, I think the minister has talked more than and giving directions and regulations than now follow through to ensure that the actual implementation is taking place. There is also a skewed way in which the public is being directed or handled. If you look at, there is a lot of complaints among the matatu transport industry,
right? Because
they feel you have the airplanes flying same capacity, but they are not doing similar capacity. Of course, maybe the safety measures in matatus is a big challenge.
Right.
While you could argue that the airplane is safer. But when you remember the reason why we have COVID in Kenya is because it came through air travel. So we have open markets, carrying out business as usual, and then you clamp down the matatus. There is a way that we still need to rethink.
Okay.
Because we need to still balance the economy and the regulations. Yes.
And Dr. Chris Omalo, we've spoken about this for so long, nearly a year now, or actually over a year since the pandemic hit the country. And you hear of those concerns of we're still not at that right place that we're able to respond effectively. And now there's the talk about African heads of state feeling like there's a challenge in accessing the vaccines, and therefore there are the discussions that in conjunction with the J&J, the South African government is going to see how 200 million doses can be prepared. What are you thinking about as a country effectively planning to vaccinate the entire population? Because many have said that you may have all these lockdown measures and everything else, but if you don't have a proper inoculation program, then it will amount to nothing in the end.
Yeah, thank you very much for that. But before I comment, first allow me to wish our Muslim brothers and sisters a blessed Ramadan Kareem. Coming to your question, First and foremost, I want to say the Kenya government, there's still room for improvement as far as the issues of managing corona is concerned. But I salute the government. They've tried. Out of 10, as Alice gives them 5, I think I can give them a 6. And His Excellency the President actually has led from the front. And remember, this is something that came, it's reactive. It had not been planned for. So it is indeed important that something that has come unplanned and it emerged globally. So the government has actually tried, because it's been a challenge even in the big economies of the world. So Kenya being a small economy, I think we still have room for improvement, but it's a fair trial. Coming to the issue of vaccinations, it is indeed a challenge, because we've seen that some of us who have already taken the first vaccine, we're not even assured of the second. In India, you know, many of these multinational corporate organizations, once you have the technology, once you have the know-how, you can be able to manufacture from any part of the world when you look at the factors of production. For instance, when you go to India, there's cheap labor. And that's why you find many multinational corporate organizations, they manufacture from there. For instance, the AstraZeneca, the one we've been taking, is being manufactured from India. But it doesn't harm. Having worked in the pharma industry, I can tell you, Kenya is already producing vaccines of different types. So if there can be a partnership, for instance, between some of the manufacturing companies in this Kenya, let's say of Cosmos, we have the Lab and Allied who have been doing all this. If they can partner with this global, if AstraZeneca accepts for that matter, they can come and assess their plant. We have many plants which have WHO recommendations or regulations in this country, so they can be able to partner. Then they bring their manpower plus the technology transfer, so that it can be able to be maybe manufactured from here. So my humble request to the government, particularly the Minister for Health, why can't he try to advance this? When you look at, yesterday I was listening to the president of Rwanda. Rwanda, in terms of pharmaceutical, it is very, very low. I know so many Kenyan pharmaceutical companies which are operating in Rwanda. And for the president of Rwanda to come and say, we've done this initiative, how I wish, because Kenya, we have the capacity, so that they can be able to partner either with AstraZeneca. I'll advocate for AstraZeneca, because in this country, the Farmers and Poisons Board has only allowed AstraZeneca vaccine. It has not allowed the one of Johnson & Johnson. And because the first vaccination has been of AstraZeneca, it dictates that our second vaccination must be of AstraZeneca.
All right, Dr. Chris, I need to move it so that we're able to conclude on this. And Gladys Bowes, all these concerns that, yes, we need to partner, the African heads of state are feeling like, and actually even Africans themselves, they're feeling like they're being left out by the global and the bigger economies in the preparation of these vaccines. But as a country, what have we done to independently procure these? Or are we just depending on donations and what the president of Rwanda said, goodwill?
I don't think they've been left out. I think they have allowed themselves to be left out. I think African countries must take a deliberate effort to attempt to partner with these other countries. And remember, they have missions in these countries. So it's possible for them to have those bilateral talks if they so wish. But our concern should not even be about acquiring the vaccine. I don't think we have seen a rollout of the vaccine in Kenya in an orderly fashion. For example, I know first they said people who are over 58 will be eligible to go for the vaccine. But everyone is going for the vaccine. Anyone who's capable of walking in there, including people who are 30 years old. So we haven't got a clear criteria that is being managed properly by the health ministry. In other countries, it is clear. First, it is the health workers, followed by, for example, the teachers and persons who are over 60. And in fact, those persons register in advance and are able to go for the vaccine. But in Kenya, it's whoever can make it to go to wherever station where there is a vaccine available, which is not really the right way of being able to roll out. So that even if we were to tell ourselves, have we finished our first line? Because have we got reports that all 400,000 health workers in Kenya have been vaccinated? Have our number of million teachers in Kenya been vaccinated? The population that is over 60, what percentage of that population has been vaccinated? Then you move to the next, but then the vulnerable persons who have predisposed conditions and so on. So yes, the rollout is haphazard. The criteria is not clear. And then, of course, what is alarming is the issue where the minister has banned importation of the vaccine by private hospitals. That also is a big concern, because reality is, as we speak now, the government hospitals only treats 41% of the sick in Kenya. 40% is by the private sector. Another 19% or so is by the faith-based hospitals. So the government should know they are incapable of covering medical needs of Kenyans by themselves. They must partner.
That decision was taken for the sake of public safety, because there were those concerns of standardization.
Banning it doesn't ensure public safety. In fact, when you ban something, then it's very easy to make it counterband. It's to be able to come in illegally. Okay. The best way is usually to allow it, but then regulate it. Because when something is transparent, then you have the ability to be able to manage it. So the government just has to be able to say, like private hospitals, most people who would go to private hospitals would not normally, unless it's an emergency, book in advance to see a doctor. So why don't you make sure that set up a rules? People should book in advance, so that even by the time the medicine is being procured by that particular private hospital, they already have an estimated number of persons that they're going to serve it with.
All right.
So it is possible to regulate it.
And
banning it is not regulating. Banning is actually just allowing more illegal channels.
Okay. Honorable Mokomore, I want to have the final word on this, because you look at some reports from the UK. They have already been able to vaccinate every other person who is above the age of 50 years. And already they're starting the second dose of whatever vaccines that they are receiving. And now soon they'll be saying that people who are in the upper scale of 40 years, they can register to get the vaccine. When do you see Kenyans getting to that point, so that you can say you're properly protected, so that even if the virus is still spreading, you're not likely to get the severe disease and require to overstretch the health facilities?
No, I think what I would also want to start rating the government's decision of the way we are handling the COVID. I would also give it the 50% mark. Given that once we do the announcement of the, say, lockdown, the issue is what do we do with that lockdown? And the vaccine came slightly above 1 million doses, which are enough to vaccinate about 500,000. And I'm sure by this week we are about the 400,000 mark.
It was actually
if you are to vaccinate 500,000, you only have enough doses for the second of that 500,000. So that one is a coordinated behavior. Secondly, the issue of the frontline workers and then the vulnerable group. We have not had the effort of actually doing the frontline workers, all of them, or even the vulnerable. Like now I had the CS Education announcing that we are going to keep the school calendar as usual. We would have wanted to hear a policy whereby you need to vaccinate the teachers as the frontline workers. But there's something else which is like an elephant in the room that nobody has been making public. There is actually resistance of people taking the vaccine, because there hasn't also been enough public education about the efficacy of these vaccines and also the safety of which the disease, the last 3 weeks before the lockdown happens, or just say the last 4 weeks, Kenya, we have had the most difficult period about the prevalence of this COVID. And I'm sure everybody now knows somebody who is either sick or dead out of it. So actually even the figures we are getting, they are quite high. The number of deaths and also the infections.
Right.
Yeah.
So do you think the minister spoke too soon, or it's possible that we can stick to the timetable? And are we able to tell that now, the school calendar?
No, I think it's just chaotic. When they open their mouth, some of these people, they don't even have an idea what they are talking about. They just talk for the sake of it.
Is it too soon, Alice Wahome?
Okay, you see the school calendar, I don't know, many of the things that the Minister for Education has spoken about in relation to COVID and the closure of school because of the COVID pandemic, I think he has just been speaking without consultation, without planning, without the material or the message being discussed and sufficient consultation. Because he will say, we are opening on this date, then the next week somebody else, he comes back and says, oh no, we have to change that. So I would have wanted to know that between now and the time the schools open, the teachers, as Maoka says, have been vaccinated. So because we have lost very, very many teachers, and the fact that they are also interacting with the children.
Right.
Then you need to vaccinate, especially those who are above maybe even 40. I suppose that all the teachers are frontline workers. And then obviously tell us, because the children environment is quite toxic in terms of, they are small, they are young, they cannot keep hygiene levels the way adults would do. We don't have sanitation in our schools. Water is still a challenge. So that then we would be saying, maybe because of that particular challenge, then we need to vaccinate all children going to school, all children that are going to school.
Okay.
So we can say that the minister also is, in my view, I think is would I say what? Is it erratic or he's overwhelmed? I think he's overwhelmed, but wants to appear as if he's managing. These are things that eventually you have to be very clear to the public. And we need very clear guidelines of how the management is happening. They are excited about lockdown. The Kenyan public is now tired of the lockdown because they are not seeing activities of implementation to ensure that then their safety is being then taken care of.
All right.
Something like oxygen, lack of oxygen. How can that happen when you have all these billions of money being spent or having been spent? It's almost reckless, and I think some people should be facing the law right now.
Right. It's important that you say that
because we don't even have bed wards, and we were told governors were given money to prepare for admission. If you actually get sick, even in our own counties, we don't have those facilities. What happened? Where is the evaluation? Has the minister clearly come out and told us, why are we not having the oxygen? Why do we not have ward beds, ICU facilities? We thought that by now, over 1 year,
right,
we have at least county facilities that can handle those basic challenges.
And Honorable Wahome, we've been looking at the questions that you're raising, and of course the oxygen question. The Cabinet Secretary explained that there was a shortage, or people were holding on to some oxygen cylinders, but late last week we saw the Kenyatta National Hospital indicating that they're going to suspend all non-emergency surgeries to ensure that they're able to attend to the COVID-19 patients. The question of oxygen, I saw some hospitals getting to Devki in Ruiru to get the donation that was promised by the management of Devki, including your county referral hospital, Muranga, KUTRH, as well as some hospitals in Nyeri and Kitui.